In the name of Almighty Allah, good evening and welcome to this hour's news package. I am Suleiman Talash. Mullah Muhammad Yunus Akhundzada, Minister of Rural Rehabilitation and Development, during a trip to Badakhshan province, met with the chief of the council, scholars, elders and representatives of Badakhshan of Bahrak district of the province. In this meeting, the residents of the district, while welcoming them, shared some of their environmental problems with the leadership of this ministry. On the other hand, Mullah Muhammad Yunus Akhundzada promised that this ministry will solve the problems of the local people according to its available facilities. The Ministry of Industry and Commerce has signed a Memorandum of Understanding and Cooperation Agreement with 12 domestic and foreign institutions that are active in the field of empowering businessmen. The Ministry of Industry and Trade says that these institutions are supposed to implement their projects worth more than $6 million in Kabul, Parwan, Herat, Balkh, Nangarhar, Bamiyan, Kandahar, Zabul, Logar, Paktia, Kunar, Kapisa, Baghlan, and Kunduz provinces. The United Nations Office, the Coordination of Humanitarian Aid, announces 2.2 million Canadian dollars aid to Afghanistan. This institution has said that this money is supposed to be used in the humanitarian aid. However, the Ministry of Economy of the Islamic Emirate welcomes the humanitarian aid of countries and international organizations to Afghanistan, but says that this aid should be used in coordination with the Islamic Emirate. More details in report.
UCHA, or the United Nations Office for the Coordination of Humanitarian Affairs, announced the donation of 2.2 million Canadian dollars from the Humanitarian Assistance Program for Afghanistan.
Canada has donated 2.2 million US dollars to Afghanistan for the current year. This institution adds that the aid has been entrusted to the Afghanistan Humanitarian Fund.
However, the Ministry of Economy welcomes the humanitarian aid of countries and international organizations for the people of Afghanistan, but asks these countries to coordinate with the Islamic Emirate.
But our request is from all countries that international organization that this assistance should be done with the Islamic Emirate and the Ministry of Economy of the country. Our purpose is oversight and transparency. We want this help to be given to people who deserve it. We have to work on areas that are basic and provide work for people so that they can get rid of begging and charity. This is even if he works, he should be provided with a job in the field of employment.
On the other hand, a number of citizens said that although the countries and aid agency have sent billions of dollars under the name of the humanitarian aid to Afghanistan people over the past 20 years, this aid has not been effective in changing their economic living conditions.
We don't have access to the help done by foreigners at all. Where is the help going? Honestly, we deserve these helps because we are poor and needy ones. Our request is from the Islamic Emirate is that the aid from foreign countries should be taken into consideration for these poor and needy people.
According to UCHA, since 2019, Canada has contributed 15.8 million Canadian dollars to the United Nations Humanitarian Aid Fund.
Maulavi Najibullah Hayat Haqqani, Minister of Communication and Information Technology, visited the residents and tribal leaders of Paktika province. The ministry published a statement saying that during this meeting, the leaders of Paktika asked to solve the telecommunication problems in some areas of this province. Meanwhile, the Minister of Telecommunication and Technology gave information about the situation of telecommunication problems in the province and said that RTA institution is planning to create 25 new telecommunication sites in different areas of Paktika province. Maulavi Abdul Wali Haqqani, Deputy of Health Services of the Ministry of Public Health, traveled to Paktia province with a technical team. During this trip, Mr. Haqqani met with the officials of the Department of Public Health and IDA Institute and discussed and talked about solving health problems and providing better health services in Paktia. In this meeting, necessary measures were taken to solve existing health problems and provide better health services. The Ministry of Public Health informed about the activity of 3 centers for cancer patients in the country, saying that these centers, in addition to diagnosis and internal services, also provide surgical services. Experts believe that the reason for the increase in cancer patients is the polluted environment, unhealthy food, wars, and electronic radiations. More details in report.
The Ministry of Public Health says that 3 cancer treatment centers are currently active in the country. And in addition to internal diagnostic, surgical operations are also performed there.
Ministry of Public Health of the Islamic Emirate welcomes those who are eager to cooperate or invest in health section. Different offices refer to Ministry of Public Health and we assured them we cooperate in all equipments they need. But the only thing which is needed in commitment in cancer hospital building that we work in diagnosis of this illness. The 3 centers which are active now are aimed to work in this part. Work in treatment. We have internal services, diagnostic services, and also surgical services. We want to develop this service and are working on it.
The spokesman of the ministry adds that efforts will be made to equip advanced devices that are not currently available in the country.
In cancer treatment part, which is a wide part, those services which we have will be given to the patients. But some patients need radial treatments and that's not in our country. Some other diagnostic equipments which are in radiology and other equipments, in addition to surgical services which need high treatment or diagnostic services. And for this, some patients are compelled to go to abroad countries. Works have started that we can have radiography services in our country and for the diagnosis services which are needy in our country, inshallah, are on the process and will be fulfilled.
Experts considered cancer as a dangerous and deadly disease, and a cause of it increases the polluted environment, use of unhealthy food, wars, and electronic radiations.
The environment can be caused to cancer because of radiations and war-stricken areas, and many other reasons. Even radiations, gases, ozone gas, foods also can be caused cancer. Genetic is related. If someone in a family has cancer, this can provide the context to cancer.
America, Hungary, Denmark, and China are countries where many women suffer from lung cancer. The main reason being the high use of tobacco in those countries.
Our This Time news package is ending in here. Thank you so much for watching.